The mouth breathing effect. A few centuries ago, the human face looked very different. It was more forward grown with wide dental arches that created space for straight teeth, room for the tongue, and plenty of airway space for easy nasal breathing. Today, faces are developing differently. From childhood, the dental arches are smaller, teeth crowd together, and the tongue has less room, all of which restricts the airway. Several factors contribute to this change. Some believe this is due to the poor nutrition and softness of modern diets, causing toddlers to have underdeveloped chewing muscles and smaller dental arches. While this is part of the problem, the bigger issue is mouth breathing, and mouth breathing is due to chronic allergies and/or tongue ties. As humans, we are obligate nasal breathers. If an infant or a child cannot breathe through their nose, they will compensate and breathe through their mouth. In order to breathe through the mouth, the lower jaw must come down and the tongue drops from the palate to the floor of the mouth. Without the tongue pressing up, the pressure of the cheeks put inward compressive forces on the upper jaw. This negatively affects the growth and development of the upper jaw as it begins to develop narrow and with a high palate. The upper dental arch becomes a V shape instead of a broad and rounded shape, and therefore will not have enough space to properly align the teeth. So as the teeth come in, they appear crowded. The lower jaw follows. It also grows underdeveloped. Teeth come in misaligned and will start to get trapped back behind the upper jaw in a retruded position. The suppressed growth of both jaws causes them to grow down and back into the airway, creating a clockwise rotational growth of the lower third of the face. The growth changes carry into adulthood. In order to breathe, we slouch our head forward to prop open the airway, creating a lifetime of neck and back pain. This is the infamous forward head posture. This is the cascade of mouth breathing. Our ancestors had broad jaws, straight teeth, and room for wisdom teeth. Why? They chewed harder foods, breathed clean air through their noses, and grew with strong forward faces. Today, our modern diets and environments have reshaped the way our faces grow. Having a healthy airway is crucial to the survival of life, and especially so during sleep. When muscles around the throat relax during sleep, a healthy airway stays open because the tongue is sitting forward and has enough space to be suctioned up against the fully grown palate. With underdeveloped jaws, the palate is too small for the fully grown tongue, which is sitting back to begin with. During sleep, the tongue does not suction. Rather, it falls back and cuts off the airway. This is obstructive sleep apnea, and like crooked teeth, it's a modern condition. During the day, this can look like ADHD, irritability, or poor focus. Too often, children are misdiagnosed and treated for behavioral issues. That's not the real cause. It's airway dysfunction. Here are the red flags: snoring, lips open at rest, restless sleep, dark circles under the eyes, bedwetting, forward head posture, chronic allergies, hyperactivity, night terrors, gummy smiles or crowded teeth. These are not small problems. They are all signs of airway dysfunction. The good news is growth can be redirected. Breastfeeding, chewing solid foods, releasing tongue ties, myofunctional therapy, and early interceptive growth-guided appliances restore healthy growth. By correcting the root cause, mouth breathing, we put children back on the path nature intended. When children nasal breathe, their lips are sealed, their tongues rest against the palate, and their jaws grow forward and wide. The result? Straight teeth, full, balanced faces, healthy airways, and not a lifetime of chronic TMJ pain in adulthood. It all starts with nasal breathing, so the tongue can guide full forward beautiful faces, wide jaws, straight teeth, patent airways, and a lifetime of healthy breathing.